Let's look at some of the characteristics of primary teeth. We can expect to see about 7 to 8 questions on this section. 1 to 2 of those are going to be over general aspects of the primary teeth. So let's start there. The most important role that primary teeth play is preserving space. Primary teeth are smaller, they're whiter, they're bulbous, and have a marked constriction in the cervical area. Primary teeth are often so white that when permanent teeth start coming in, I get parents come in saying, why are my kids' permanent teeth not white enough? But it's not a problem with the permanent teeth, it's just that primary teeth are so white just by nature. In primary teeth, enamel rods form differently. Take a look at this diagram, because I think this can be a little bit confusing just from the words. You'll see in your text that says enamel rods extend occlusally, which is the opposite of permanent teeth. But what does that really mean? What they're talking about is in permanent teeth, enamel rods extend in this direction, while in primary teeth, they extend from the cervical area in a more occlusal direction, like this. Let's talk about the primate space, because I can almost guarantee you're going to see a question on this. Take a look at the photo of primary teeth in your book. The primate space is present about 50% of the time. When it's present, in the maxilla, it occurs between the lateral and the canine. In the mandible, it occurs between the canine and the first premolar. The primate space occurs because of growth in the dental arches. Let's focus in on the maxillary primary teeth now. Out of the 7 to 8 questions we're going to see on primary teeth, 3 to 4 of them are going to be right here just on the maxillary primary teeth. Let's take a look again at that diagram. Take a look at the maxillary central incisor in this photo. You'll note that this incisor is the only incisor, primary or permanent, that is wider than it is tall. This incisor has a very prominent facial and lingual cervical ridge. As a reminder, there's only going to be one question on this maxillary central primary incisor, and it's going to be over one of those 2 points. The maxillary lateral incisor, most years there's not a specific question over this tooth. The questions we see relating to this tooth deal with the primate space. Remember where that is? That's right, it's between the lateral and the canine on the maxillary, between the canine and the first molar on the mandible. Take a look at the maxillary canine in the photo. This tooth has something very unique to it. This is the only canine in the mouth, primary or permanent, that has its cusp tip offset to the distal. This makes the mesial cusp ridge longer than the distal cusp ridge. If you see a question about this tooth, that's the most likely point for them to hit. You're likely going to see a couple questions on the primary maxillary first molar. This is the most readily identifiable primary tooth because of the buccal cervical ridge on that mesial buccal. I'd be very surprised if there wasn't a picture of this on your test. This tooth looks a lot like a maxillary second permanent premolar, but has roots like a permanent molar. This primary molar, like all primary molars, lacks an identifiable root trunk. This tooth, just like all primary molars, has a flat facial surface that extends from the occlusal down to that prominent cervical ridge, and that's in contrast to all the permanent molars. Let's take a look at the last tooth in the arch, the primary maxillary second molar. Note that this tooth has the greatest buccal lingual dimension of all the primary teeth. It looks very much like a permanent maxillary first molar as far as cusps, roots, grooves, and it even sometimes has a cusp of Carabelli. Let's take a look at the mandibular primary teeth. We're going to see 3 to 4 questions on the mandible here about primary teeth. Let's take a look at our diagram again. As you can see in the picture here, all incisors have prominent cervical ridges on both the facial and the lingual. Also, no mamelons are present on any primary incisors. You're not very likely to see questions specifically about the mandibular or the lateral incisor. If you do, know that the mandibular central incisor is the smallest tooth in the mouth. The mandibular lateral incisor is slightly larger than the central and less symmetrical. Take a look at the mandibular canine here. This canine follows the same pattern as all the other canines in the mouth, where the cusp tip is offset to the mesial. The only exception to this was that maxillary primary canine. As with all canines, this canine has 4 developmental lobes. Clinically, the most important concept with any of these canines is the primate space. Remember where we found that? You got it. Distal to the canine, highlight that. Remember that. Remember where it is in the maxilla? That's right, it was distal to the lateral. Take a look now at your mandibular first primary molar. This tooth doesn't look like any other tooth in the mouth. You can see how it is lingually inclined. It has a very dominant mesiobuccal cusp, but the mesiolingual is the sharpest. Make sure and note that. Don't get tricked up by thinking the mesiobuccal, even though it's the biggest, is not the sharpest. The mesiolingual is the sharpest. We've seen that asked very definitively on test questions. This tooth has a very distinct transverse ridge. Because of its anatomy, an MO restoration can be very difficult. Make sure you can identify this tooth from the occlusal view, because we've seen that over and over on old tests. If you see a question on the mandibular second primary molar, it's likely going to be related to how much it resembles a permanent first mandibular molar, both in cusp form and root form.